Okay, so Betsy, I really want you to talk about vaginal health in particular. We've talked a lot about pelvic pain, hysterectomies, which is so good, so amazing. Thank you for sharing all of that for our ladies. So, getting into more vaginal health related topics, I know UTIs are a big one, yeast infections, bacterial infections that I know some women struggle with, and some of them like, kind of get in that cycle of like they have them, they get rid of them, they have. That's what I see when I hear from women. It's like okay, and I've had my own experience with ascent of UTIs, but I finally got stopped because I worked on rebalancing my pH. That's actually what got me to get my UTIs to stop. And they got started because I did not listen to my body and go pee as often as I needed to. Because I was training clients, like I'd work like back to back hours and I'd be like, oh shoot, I didn't give myself time to pee. It's okay. I'll wait 1 more hour. I'll be fine. Ladies, don't ever do that. It's not good for you. I learned the hard way. But anyway, Betsy, I want you to take over and talk about all of this because I know so many women deal with all this stuff.
This is a topic that gets me so excited. So, and once again, not something that we're really taught in medical school, even to this day. I mean, what gynecologists are taught about vaginal health when it comes to like the microbiome, which is the bacterial and yeast balance in the vagina, it's still stuck in the 1950s. So, that's something. I've gotten lucky because I look back at it now. I got lucky by having so many of my own yeast infections and bladder infections. And I was like, well, you know what? I want to figure this out for myself. And then over the years, it just became this thing where, all right, every time I figured out something for myself, I started trying it on my patients. I'm like, oh my God, this works great. Interesting enough, how I got into like studying the vaginal microbiome was not because of urinary tract infections, vaginal infections, but back in the early 2000s, we were putting a lot of vaginal mesh into people because at the time, that's what we did for prolapse. And people would develop something called an erosion where the mesh would kind of pop through the tissue. And sometimes it was easy to deal with, sometimes it wasn't. But I wanted to know why was that happening. So somehow, somewhere, this company came to me that tested the vaginal microbiome. And in traditional medicine, we didn't have that option. This company, where we would swab the vagina, and they would look for the DNA presence of bacteria and yeast in the vagina, and then you could treat it. So that was about 15 plus years ago, I started doing that because I was looking to try to find out if there was a bacteria that was associated with these erosions. Fast forward, so I was swabbing everybody that was coming into the office, and fast forward, I started to see a pattern where the women who were getting recurrent vaginal infections and recurrent bladder infections, and in my mind, it's the same process. Even though it's two different places that people are getting infected, it's the same exact process, and I'll explain in a minute. But I was starting to see patterns of bacteria. And so this is when I realized that if we give somebody antibiotics for their bladder infection and it kept coming back, well, it was because the bladder wasn't necessarily the problem. It was the vagina was the reservoir for the bacteria. And if I didn't get rid of the bacteria that was in the vagina, because the vagina and the urethra, the tube you pee through, were so close together, that bacteria was just kind of getting back up into the urethra from either sexual activity or from wiping, or from people wearing thongs. Because I always joke that thongs are kind of like the butt dental floss, and you walk they're going back and forth every time, and I mean, it's nice not to have the panty lines, but you're risking your health with those things. So, I started making that connection, and then fast forward, I was seeing patients who were getting recurrent yeast, and I was like, well, I'm giving them yeast medicine, and we're giving them diflucan to take. They're taking oral pills, and they're using these messy creams, and it's still coming back. Where is the source of this bacteria? And somehow, somewhere, I decided to start testing the gut. And so we can do microbiome stool testing. And what I was finding out that women with recurrent gut gut yeast were getting recurrent vaginal infections. So the problem wasn't the vagina, the problem was the yeast in their gut. And so it wasn't until I took care of the yeast in their gut that now all of a sudden their vaginal infections were going away. And this is what happened for me, because I was getting recurrent yeast infections from the time I was 13 until the time I was, God knows, my 30s plus. So once I healed my gut of yeast, I haven't had a yeast infection, and I can't even tell you. I mean, it used to be like every couple weeks, and now, I mean, it's maybe every couple years, if that, and usually related to being on antibiotics. So and then I started looking into, well, the bacteria that was getting into the bladder was coming, a lot of the top UTI bacteria is gut bacteria. And so our rectums, vagina, and bladder are so close together. So what was happening is we were getting these shifts in our bacteria in our gut, and now that's close to the vagina, and the vagina was becoming colonized with these, quote, bad bacteria, and now that's one step closer to the bladder. So I have found that really it's a matter of not just balancing pH, which is vaginal pH will get thrown off when the bacteria in the vagina is thrown off. So I actually, on my Femversity website, we have a really awesome course. It's called the Vagina Reboot. And so that actually is like 2 weeks. You can rebalance your vaginal pH and get rid of itching, burning, odor, recurrent urinary tract infections, and recurrent bladder infections all naturally. So it goes through 2 weeks of how to rebalance the pH. That course does not talk about gut rebalancing, because that's a little bit, I needed
deeper.
I needed like a basic course that was going to help like a good portion of women, that they could get a quick win, because the gut rebalancing is a little bit longer and more intense, and we're in the process of trying to create that course, because that requires physician testing, and it's not something you can easily just do on your own. But so this was, it's definitely the combination of all this. Now, once you have a urinary tract infection, this is the other problem, is that the bacteria can actually attach itself to the lining of the bladder. And so in traditional medicine, all the like infectious disease research says 3 to 7 days of an antibiotic and you'll be good. But I can tell you, over years of doing this as a urogynecologist, I was getting all the people that were coming in that had that pattern, like they had a urinary tract infection, they go to their primary, they get 3 days of an antibiotic. 2 weeks later, it's back. And now, because they didn't get rid of it all the way, they quieted it down, but that bacteria is still there. Now they have to go, and like 2 weeks later, it's back again. Now they get 5 days. Now they get 7 days. Now they get something like, maybe they get Cipro, which personally, I hate ciprofloxacin as an antibiotic, because it's been shown to throw off your gut microbiome for a full year just with one course of Cipro.
Betsy, hasn't there been like some really other gnarly side effects that Cipro has caused? Like literally has like debilitated some people. They put me on that 2 or 3 times, because one of mine went to my kidneys.
Yes. Yeah.
Which was bad. And I didn't know any of this stuff about Cipro till like after the fact. And I was like, thank you, God, that I didn't have any problems, obviously beyond the wiping out my microbiome. Yeah, that's a whole other story.
Well, but, I mean, sometimes there are times we have to use it because it's better. God forbid it goes to your kidneys. Yeah. But it's one of the ones you need to use. But it's like, they found that you can have ligament tears related to being on the antibiotic. I think the key is to be on the least strong antibiotic. People are like, well, I want the most. I want to bomb this thing. No, you don't. You want to be like the sniper. You want that antibiotic that's going to be the sniper and target exactly what you have, not be like this nuclear bomb that kills off everything, even the healthy stuff. So that's where this is my frustration. This is my frustration with patients, but it's not because patients are wrong. It's because they're not educated, because doctors are not educated. So many patients will be like, I have a UTI. Can you call me in an antibiotic? That is the thing you do not want to do. You don't. Now, I know sometimes these things happen at like a Friday at like 7 o'clock at night when the doctor's office is closed, or Saturday when no place is open. And then you got to just, you get called in something because there's no other choice, because you don't want to necessarily wait through the weekend. But if the ideal thing is if when you have symptoms to go in and get tested. And because you want to know exactly what it is, so it's being treated exactly the right way. And if you're having that pattern where and I hate antibiotics. If I cannot put someone on antibiotics, I prefer not to, because it affects the gut microbiome. It affects so many other things. But sometimes when I see that pattern where they have an infection, it goes away and comes back, and it goes away and comes back, and they're doing these short courses of antibiotics, sometimes I need to put people on a full month course of something like macrobid or Bactrim, like a full month to get it out of that tissue. But at the same time, we really need to be eating like probiotics and, probiotic foods like yogurt and kombucha and kimchi and sauerkraut, or taking probiotics, which doing that by itself can help prevent all these problems, because we're keeping the gut healthy, keeps the vagina healthy, keeps the bladder healthy. So, combination of all that. And, and another thing I find really interesting is, I think as a doctor, sometimes we get too focused on the treatment as opposed to the prevention. And we just assume like, oh, everybody knows how to prevent this. Or because that's not as sexy to talk about prevention, sometimes we forget to talk about it. But I can't tell you the number of women that I've talked to that don't wipe ideally. I'm not going to say properly, because that puts shame on it. There's no right or wrong way, but there's an ideal way to wipe. And the ideal would be from front to back. Now, people get in kind of contorted and all kind of like trying to get their hands and arms to go front to back. If you can't do front to back, like some people will come and they'll put their hand behind their butt and come from the back and try to do front to back. I don't have the dexterity to do that, I'll tell you. And a lot of my patients don't. You can take your hand with the toilet paper and go from front to back, because you're trying to wipe from basically the cleanest area of the body to the dirtiest. So you don't want to be wiping the bacteria from the dirtiest towards the cleanest, because you don't want to be bringing that bacteria closer. But I also tell people just blot in place. You don't need to you don't have to worry about wiping if you don't have the dexterity or to do it. Just blot in place. And so that's one thing. I've actually seen women, and this was something that it took me a long time to figure this one out. I had some women who, one time somebody asked me, do you think I'm getting recurrent urinary tract infections because I'm sitting on the toilet and then I flush, but I'm still sitting on the toilet after I flush? And I was like, oh my God, I never thought about that. Because when you flush, you aerosolize the bacteria in the toilet, and that could be getting on the perineum. So I actually had to start telling patients, like, listen, you know what? Do whatever you got to do. Wipe, stand up, walk away from the toilet, pull your pants up, put the top down if you're at home, then flush, so because you don't want to be getting that bacteria spread all over. And, actually it's interesting, in Europe, they have less UTIs than we have in America. And you want to know why? They have bidets. Yeah. Mm-hmm. So I think bidets are starting to become more popular. I am definitely a fan of the baby wipes, but I will tell you, with the baby wipes, you gotta, especially after bowel movements, because honestly, think about toilet paper. All it's doing is spreading that all around your butt. And if that's on your butt, and UTIs and vaginal infections, you could be the cleanest person in the world and it can still happen. It just has to do with a bacterial imbalance that even stress can cause a bacterial imbalance. So there's a lot of different things that can do that. But, with toilet paper, we're just kind of wiping that bacteria. It's not getting that things clean. So with the baby wipes, I like them because they tend to clean a little bit better. It's better than kind of installing a bidet, even though they have some toilet seat bidets that won't break the bank right now. But with the baby wipes, I have to tell people to really look at the ingredients. My favorite ones right now are the ones that are just like, there's a brand called Water Wipes but there's a lot of other brands that have just come out with ones that just have water on them. That's it. They're just water. So because some of the other ingredients and some of the other wipes can be very irritating to like the delicate tissue down there. Or, you can even just, take toilet paper and water, like, whatever you got. And toilet paper sometimes breaks down very quickly, but just to kind of clean that area after bowel movements is like a good idea. So those are some like base. And then what the reason we tell people to urinate after sexual activity is because bacteria from the vagina, from like any activity down there, can get pushed up into the urethra during any kind of sexual activity, whether that's with a partner, whether that's with masturbation. And so what ends up happening is now that increases your risk of urinary tract infections. So peeing after sexual activity will help to flush that bacteria out. And so also just, this is the other thing, 75% of Americans are chronically dehydrated. The more we drink, the more we flush our system, we flush that bacteria out. Holding it isn't necessarily a problem as long as we're drinking enough that we're going enough. So that
question two with bladder and peeing is women making sure they're relaxing and not being in a rush when they pee. I go talk about that because we've talked about that here before, and I just think I have a lot of moms, right? We're in a rush, like, you gotta go from this thing to this thing, and you sit and you pee and you think you're done and you're not really done. And especially if you are in that cycle of UTIs, like that can worsen them, right? That could possibly bring them on, all of that, right?
Well, the other thing is, as women, we often do, because we're in a rush, we go in and we bear down to get it out as fast as possible. Yeah, number one, you don't tend to empty out all the way. And the other thing is, the urine's going to go where the least amount of pressure is. And if it's not out of your body and you're bearing down, it could go back up to your kidneys. So really, we're designed as humans to sit. Well, actually, we're probably designed to squat in the woods, but nobody's doing that. So we're sitting on a toilet, and we should be relaxing. The bladder is a big, giant muscular bag. That's all it is. It's one big muscle. And so the bladder will push for you. So the bladder is going to do the pushing. Let it do that. That's the way it's supposed to happen. The other thing is, if you're tense, you're not relaxing your pelvic floor muscles, which is not allowing your urethra to open all the way. And your urethra is the tube that you pee through. So if that's not opening all the way, your muscles need to be relaxed to get a good flow. I know a lot of people don't want to sit on the toilet, especially in public places. And we tend to do the little hover maneuver. When we hover, and I'm sure you talk about this, we activate our pelvic floor muscles to keep us from falling over. We need it for balance, but you cannot empty all the way. So, I mean, do I hover? Yes, I do. I mean, you've seen all that, I don't know, women, we do terrible things to our public bathrooms. They're horrible looking. But if you can like line the toilet seat with paper is a good idea, or use those covers. And actually, and you won't get me doing this, but actually in truth, you're not going to get anything from a toilet seat as long as it's dry. And if you think about it, what part of your body is touching a toilet seat? It's really just your buttocks and your thighs. Now, not to creep you out, but if you wear short shorts and you're sitting on a bar stool in a restaurant or a bar, those parts of your body are touching the same as what would be touching on a toilet seat. But nobody's worried about sitting on a bar stool, but we're all creeped out about sitting on a toilet. With that being said,
point. It's a very good point.
It's not like people are like wiping their vaginas all over that toilet seat. Like that's not happening. So, but with that, I too am creeped out by sitting. I have to say I love Wegmans. I know, not that I need to be plugging, but Wegmans is the one bathroom that not only do they have toilet seats, but every Wegmans supermarkets in the Northeast here that I've ever been in, they have like cleanser. They have like disinfectants like on the wall that you can spray on a piece of toilet paper and like wipe the seat off with a disinfectant before you use it. So, some of the airports I've seen, they have these plastic covers on the toilet seats and you wave your hand over and the plastic cover just scoots around and like a new cover covers the seat. That's pretty cool. But honestly, like, as long as the toilet seat is dry, like there's not really, I mean, for you to pick up a disease from a toilet seat, it has to be like within seconds of, I mean, other than like the flu, but you're not going to get flu of the butt or the vagina, like, like when we're thinking of like, a lot of people think are sexually transmitted disease, it really needs skin to skin contact. So yeah.
Oh my gosh, I love this. I love this. Oh, Betsy, this has been so, so amazing. Okay, so as we wrap up, is there anything that we haven't yet talked about that, which I know we could talk for hours, but like anything really big and important that you always like, this is something in my messaging I want to make sure that all women know. We've covered a lot of really good things, and I'll have to have you back on again another day. We'll go deeper in conversation because I think everything we've talked about today is just, it's under talked about, and it's good to have these conversations. So I appreciate you.
And
Thank you so much.
I think that is the biggest point, is that we need to have these conversations. Like, in my house, I have two teenage girls who are probably sick and tired about hearing about vaginas. It's like, like it's the normal conversation. But that's the thing. The more we talk about it, the more we desensitize ourselves to the topic, and it becomes less taboo. Like, it's just a body part. Like, there's nothing that we should be ashamed of. These problems are super common. I can't tell you how many women would come in my office and think they're the only one that this is happening to, because there's an isolation when we don't talk about this stuff. Like, it might be, like, you might not going out tomorrow to have lunch with your girlfriends and be like, hey, I'm having some vaginal itching today. But you know what? At some point in my life, I would love people to be like just sitting around, at the dinner table with company, because everyone's comparing their sports injuries, especially as we get older. We're like, man, I tore tore this, I tore that, like, talking about genitals, it's just another body part. And the more we talk about it, the more we become desensitized. And even if it's where I say people could just look in the mirror, and if you're uncomfortable saying the word vagina or vulva, like, sometimes I get the women that go after me and they're like, you're saying vagina when the outside is the vulva. Yes, the vagina is just the tube inside, but I'm happy if we talk about any parts down there. So if you need to like look in the mirror and just practice saying those parts until it becomes like easy and you're like, yeah, whatever, vagina. Like I said, because I didn't go into medical school to be like, hey, I'm looking at vaginas all day long, but looking at enough of them, talking about enough, it's something I can easily talk about. And I really want other people to get to that point, because these kind of health conditions can really affect someone's quality of life. Yeah. And it doesn't have to be that. And these problems are so common. Ask for help. There's no question that is a dumb question. Ask for help. There's people out there that can help you, and you don't need to live with anything of this. So yeah.
Absolutely. Yes. Okay, so can you briefly share about your Vagina Summit coming up, which I'm very grateful that that you invited me on to be a speaker. So everyone listening, my talk will be on there, which I'm super excited about. And everyone needs to know about this. So will you share a little bit about that? We'll put all the links to everything in the show notes, of course, so everyone can easily find it, sign up. You are all going to want to listen to it. So
I'm so excited. We're doing our second annual Happy Vagina Rally. So I decided that I just needed to get more people talking about pelvic health. But the nice thing about the Happy Vagina Rally is it's not just about pelvic health. We're talking about all things women's health. And it's going to be live August 10th through 13th of 2023. And we have 40 plus speakers talking about everything from pelvic health to sexual health to hormone health to hair health to having more energy. Like anything we could think of that had to do with women's health, we put it all in one place. So I'm really excited. And so Erica has the code for that, so that you can take a look at that. And the other thing, Erica, we're going to get you another code, is I have a website called the Pelvic Floor Store. So it's Pelvic Floor Store. And we'll get Erica a link for that too. because I found that women were having a hard time finding reliable pelvic health products. And so I started it as a website where I was putting products I was recommending to my patients. And so I would tell my patients, like, hey, here's your one-stop shopping. Go here, you can get what I'm telling you. But it's kind of grown. So as word has spread, more and more people have found it. And so now it's actually starting to become a bigger thing. So Erica will have a code for that one too.
Yeah, I will
So
put it all below. And we just share your website. So if people want to reach out to you, they know where they can easily find you.
yeah, so it's being updated right now, but it's drbetsygreenleaf.com. So, have patience with that. But honestly, you're better off finding me on social media, whether it's TikTok or Instagram or Facebook or LinkedIn. If you look up Dr. Betsy, Betsy, and then Greenleaf, Greenleaf, you'll find me in one form or another. They might not exactly be spelled that way, but sometimes they have you can just look up Dr. Betsy Greenleaf, you should find me. So, yeah.
And I'll put it all below. So thank you so much, Betsy. This is such incredible, incredible conversation. And I'm so grateful for you and all the work you are doing as well. So we can help women live better quality lives.
Wonderful. Thank you for having me.